My name is Kirsten Sasaki, and I'm a minimally invasive gynecologist. My mixed background includes a 2-year fellowship in minimally invasive gynecology where I focused on hysteroscopic, laparoscopic, and robotic-assisted procedures, and part of my practice focuses on uterine preservation or fertility preservation for my patients. The most common hysteroscopic procedures that I perform include resections of uterine polyps, uterine fibroids, lysis of intrauterine adhesions, transections of uterine septum, as well as shaving of uterine isthmoseals or cesarean section niches. Some of the benefits of hysteroscopic resection are that you can remove multiple types of pathology, so polyps and fibroids. You could also do an endometrial resection at the same time. Another benefit is you could obtain hemostasis with the same instrument, and you can often access fibroids that are in very difficult to access areas. So the fundal fibroids or corneal fibroids, you have a better angle and ability to resect them and resect them completely. I think hysteroscopic resection is an important skill because it's a versatile tool. It's something that allows you to treat, like I said, the entire pathology and give your patients one procedure instead of potentially undergoing multiple procedures to remove their entire pathology. I find that the resectoscope has the highest utility in very dense or calcified fibroids, and especially in type 1 or type 2 submucous fibroids. The reason is you can actually remove the intramural portion of the fibroid versus with some of the other technologies, it's very hard to remove that intramuscular portion of the fibroid. It's important to remove the entire portion of the pathology because if you do not, their symptoms will recur, the pathology will start to grow again, and especially in someone who's trying to attempt pregnancy, it can delay their journey. So you really want to remove the entire fibroid, not just the portion that's within the cavity. The most important features to me of a resectoscope are that there's continuous inflow and outflow, that it's durable, that it has a narrow, small caliber outer sheath, and it's easy to put together. My overall impression of the Princess Resectoscope is excellent. I enjoy using it. The staff doesn't have trouble putting it together. It's easy to troubleshoot. Like I said before, it's very durable. It's very lightweight, which is good for me. I have small hands, and it also has sort of a sleek profile, so you don't get fatigue holding the instrument, during a longer procedure, and it fits my smaller size 6 hands, which is good because you don't get, instrument fatigue during the use of it. The features of the Princess Resectoscope that I like are that you only have to dilate to 7 or 8 millimeters depending upon which resectoscope you're using. You can use normal saline, so I'm not worried about reaching my fluid deficit, so you can use bipolar or monopolar energy, and that the loop is very durable and it holds up very well over time. So I like and continue to use the Princess Resectoscope and will continue to use it because I like the device, I trust it, I rely on it for treating my patients, and I also like the support that Richard Wolf provides to us. It's not a procedure that I necessarily do every day, so sometimes it's nice to have a refresher, to just have support, and their support staff is always available to come to the operating room, which is huge.
Richard Wolf, Spirit of Excellence.